Did you start? Yeah, okay, then now we'll be discussing blood supply to the heart. Okay, blood supply of heart. How many chambers in the heart? Four. They are. Let's make it big. Two pictures. We have here anterior view. Here we'll be having posterior view. The big. And now in this place we have which structure? What's that? From it leaves in the left ventricle, it will be aorta, right? And then the first two branches of aorta is right coronary artery and left coronary artery. Right coronary artery goes between two chambers, between right atrium and right ventricle in sulcus, right? And it goes back on posterior surface. Let's stop it here. The next branch will be left coronary artery. It divides into two branches. What are they? No, not circumflex anterior. We have two branches. The circumflex artery, then yeah, the trunk divides into two branches, right? This one and this is left circumflex. LAD goes descending on which sulcus? Yeah, sulcus, anterior interventricular sulcus. It goes along this sulcus and gives to the sides. It's called septal branches, and it goes to this side. It will be called diagonal branches, right? It will reach the apex, and we have here incisura apex cordis. And the next branch is circumflex artery, right? Circumflex artery, it will be going also backwards, and it will cross posterior part surface of the heart. And let's change the view of our heart, our organ. This is the left atrium, this is left ventricle, and this is the apex, right? Apex. And if you look from posterior surface, which if I draw this picture here, this structure, and like that, this one, could you tell me, is it right side or left?
Left.
This one?
Right.
Left side, this is right side. So this will be the left atrium, this will be left ventricle. This one, right? So we were talking about let's continue with the right coronary artery. It reached the posterior surface of the heart, and it will be coming right here, right? If you remember, it will come on the posterior surface. On our between the atrium there is a ventricle, there is a sulcus, and it will be going downwards, yeah, downwards, giving posterior interventricular artery. And it has another branches right here. It will give, the heart has two margins. We have acute margin and we have obtuse margin. If you remember, this will be acute marginal artery, and we have two, there are lesser branch like sin to SA node, right? We have branch to AV node, to conus branch, and so on. Then that was on the posterior surface. It gives another branch, another big branch. It's called marginal artery. Marginal artery. Then posterior marginal artery. Then we are talking about our circumflex artery. It was on the posterior surface. It will be coming right here. Yeah, it will be coming here, going backwards, and it gives. We have another margin of the heart. That was acute one, and acute marginal branch. This will be obtuse marginal artery. We have the first one, second one, and so on. And sometimes this our circumflex artery can give rise to posterior interventricular artery also. Okay, that was the blood supply. I mean arterial. Let's talk about the venous blood supply. What kind of veins you know in the heart?
Veins in the heart, we have superior ventral and inferior ventral.
No, I mean the proper. I mean the first one you can see in that file here, right? the first one, vena cordis magna, it will be coming where? It will be start. The apex is here, right? I'm just drawing like that in order to give clear details about the sulcus. But in general, it should be coming like here to the apex of the heart. And to the apex, from the apex, we take blood and goes near of our LAD. It will be going up, getting blood from two ventricles. Yeah, it will be vena cordis magna. It will be coming here. That was the first vein of the heart. The second vein of the heart is media. It comes where? When it comes? Where it comes? In which part? That was anterior one. This will be posterior one. It will be coming next to posterior interventricular artery. It will be going up. Yeah, it will be going up, getting blood from the sides. And now we have behind of right atrium, we have big structure. What's that? Yeah, coronary sinus, right? It will be getting blood from all the veins of the heart. The first one will be vena cordis magna, vena cordis media, and we have here vena cordis parva, and we have the next one is posterior and posterior ventricular. Some branch will be coming here. Yeah, and we have which one? Oblique. It will be in which one? Right, left atrium? Yeah, like this one, right? It will be draining. It will be oblique vein of the heart. Vena cordis obliqua. You can say oblique vein of the heart or vena cordis obliqua. That was all the branches, mostly all the branches of the heart. That mainly what you need. Then, yeah, you can. It will be. You have some small branches from the ventricles and the right atrial branches, and now we have anterior ventricular branches. You'll be getting blood right here, like that. Anterior ventricular branches. It's the venous branches. Is it clear? That was blood supply of the heart. Then, do you have any questions right here? No, right? Okay, then let's stop this one. Okay, let's stop this one. Will be now circulation.